Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and also your host for this evening, You and Your Doctor, Living a Longer and Healthier Life, presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And I've got to tell you, I can vouch for the ability that they have of being able to be compassionate, of listening, taking the time to really work with whatever needs you might have. And I'd also like to thank them for bringing on our guests. They have done an amazing job on bringing to us some of the superstars in their field. So I would just like to thank them again for all that they've been doing to help educate all of us. You, our audience, myself as well. And you can watch us. You can listen to us on 1470 AM. We're also on 95.3 FM. So listen to us there. Or you can watch us live on Facebook at All County Healthcare, where we're streaming right now. So welcome our Facebook friends. If you have any questions whatsoever for All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any of your questions. And that's also a great way to be able to get a hold of the doctors as well. So without any further ado, we have another fabulous doctor guest on our show tonight. And his name happens to be Dr. Michael Joyner. And he comes to us from his own private practice called the Joyner Hand. I love that. The Joyner Hand.
Great. Thank
Very
you.
cool. Very cool. So welcome to our show tonight. And tell us a little bit, first of all, where did you do your schooling? Are you a Florida native, or did you move here? Or give us some background about you.
Well, first of all, thank you very much for having me. I appreciate it. Just give you a little background. I'm originally from Los Angeles, California, where I grew up. Exactly.
Wow.
Went to high school there, started college out there, UC Berkeley. Then went East Coast, Howard University. Graduated from Howard University.
You went from one coast to the other coast, huh?
Yes. And then I did medical school at Georgetown University.
Oh, my goodness. One of my other favorites.
And I served in the Army. They paid for school. So I did 5 years as a captain in the U.S. Army. And then I did general surgery, my background, general surgery. So a lot of trauma surgery. I was based in Atlanta. And then I decided to go into the subspecialty, hand and microsurgery. And I did my training in Louisville, Kentucky.
You've been all over the board
so
here.
my exposure has been a wonderful experience in many different ways. And the hand surgery in Kentucky, we did really one of the first hand transplants there. So it was an incredible institution.
Oh, my goodness. You're kidding.
So
I
was very fortunate to train there.
That is incredible.
Exactly.
That is incredible. Well, when you're talking about the hand, you're talking about such delicate tissues and veins and muscular muscles,
You're absolutely,
ligaments.
you're absolutely right. You're absolutely right. I put it in the category of microsurgery because really everything in the hand is very small, very tedious, very important.
Yeah.
So it's a field that I love. You go from anyone from age 2 to 92 in a day that you may see. And sometimes you forget how important your hand is.
Oh no, I never. do.
Right.
Oh no, I know how important.
Right.
And I think that one of the things that makes you really realize how important it is if you have an injury on your hand, and all of a
Exactly.
sudden you can't use it anymore. Then all of a sudden it's like, oh boy.
Right. Exactly.
Unfortunately, we all take our bodies for granted. And it's until we end up with some level of or injury do we understand how important that body part is.
Occasionally, I would do some mentorship programs to young kids, and I would go speak to some of the schools. And I spoke to a group of 4th and 5th graders, and I had them tape their thumb and try to write.
Oh my God!
Right. And
That
so it
is
was
fabulous.
an incredible experience. So
That
that's just an
is
example.
fabulous.
That's an example.
That is wonderful. Well, and I kind of understand that because I've been dealing with like a little bit of thumb issue for I think like a couple of years already, and it just comes and goes. But I do understand that all of a sudden I can't open a bottle top,
Right.
or a jar. It's very, very tough. Or the other thing, just squeezing shampoo into my hand.
Right. It's so important. It's so key. And a lot of the things I focus on in the practice is exactly that. So when someone comes in with an injury or pain, we definitely look at each person differently because the amount of work you're doing or your hobbies makes a huge difference in how you treat the hand. It's definitely not cookie cutter. And so if you're right-handed versus left-handed, you have a hobby. Someone may be gardening, someone may be knitting, someone may be doing carpentry.
Golfing,
Exactly. Tennis.
lifting weights.
Tennis,
Yes.
exactly. And
Yeah.
everybody's just a little different. So that's one thing I love about the hand as well, because you'll take extra time and not only doing your history and physical, but you're really taking time to get to know, okay, what's our goal here? What are we really trying to do? Are we trying to get back on the golf course? How many times
I don't know
a week?
of any.
That type of
I
thing.
don't know
Right,
of any
exactly.
golfer who doesn't want to get back on the
Right,
golf course
right,
as
right.
quickly as possible.
Exactly.
And for some of those golfers that are just really fanatics, I mean, you're talking 3, 4, 5 times a week.
It can make a difference.
And
Right.
and sometimes they can do that because of retirement, and a little overdone,
Exactly.
unfortunately.
And when you say overdone, overuse injuries are something I see quite a bit.
Oh, okay.
One example is classic carpal tunnel, which can be overuse of your hands. But I always like to use one example. I had a pianist who came, and they really were playing a lot of their instruments, and they started to get these symptoms of like a carpal tunnel.
Tell me what the symptoms are. I don't mean to interrupt you, but sometimes I hear it all the time. But
Right.
what do they experience when you have it?
Classic symptoms, one will have numbness and tingling sensations in their fingertips. Most
Okay.
commonly, it comes at night. So it's almost as if your hands fall asleep.
Oh,
Exactly.
Okay.
And so what it is sometimes you're putting a little too much pressure on the nerve. And when you bend your wrist, you put pressure on the nerve that goes to your fingertips.
I see.
And a lot of times with overuse, you'll keep irritating the nerve. So there's different treatments. And in general, if you get to it early enough, you don't have to have surgery. A lot of people think they have to have surgery when they have carpal tunnel.
Really?
But it's not true. If you address it early enough, and in this example where this person was playing the piano, I mean, for concerts and every day, and they really stepped up the amount of practice they were doing, and they started getting these symptoms quite a bit. Well, we were able to analyze his ergonomic position of his hands.
Oh.
And just by going back in the basic fundamentals, we were able to treat the carpal tunnel by taking steps back, changing the position of his hands. And we didn't, no surgery, no anything,
That-
corrected. Just some splinting at night, but that was it.
That's
Right.
amazing.
So it was amazing. So every person's different.
So then he was playing like this? No, I'm teasing. That's
Right.
that's
so it's good.
amazing.
So that's
because-
one of the common things I see in the practice.
Okay.
One of the common things I see.
What else? What other common issues do you find in your practice?
Well, I definitely see a lot of traumatic injuries. So, say someone breaks a glass in there with a dish, they may cut a tendon, may cut a nerve, or a broken bone in the hand, finger, wrist. But in general, besides trauma, I'll see a number of people with arthritis. So, especially arthritis in the thumb. They have difficulty turning a key or have pain. And there's so many different treatments for that too. And that's one thing. Some people don't realize that there are treatments for arthritis.
I know.
And a lot are conservative, you know.
Really?
And you go to extremes. So you can start off with, it could be something as simple as splints or sometimes a steroid injection or analyzing your hobbies. Or to the extreme, I'll replace a joint, almost like someone's hip. So they'll have a ball and socket for their thumb to eliminate. Right.
You know, so that we don't hear about
Right,
that.
we don't hear about it, exactly.
No,
and so that's the
we
thing.
hear about the hip. We hear about the knee.
Exactly.
And tonight, with the other doctor, with Dr. Cohen, we heard about shoulder. Because I've not heard, I really don't hear very much about shoulder, but with the hand.
Exactly.
Oh,
We do
my
the full
goodness.
replacement in the thumb.
Really?
Exactly. We'll even do in the wrist, if necessary, different joints, full joint replacement. And then some of the most basic things I see every day are like a trigger finger where your fingers lock up. And so many people don't understand that if their finger starts to lock and click, that the sooner you treat it, the better. Because if you wait too long, then that's when sometimes you may need surgery.
Oh, okay.
Right.
Our audience, this is really important. If you hear locking or clicking in the joints,
Yes.
get to the doctor.
Yes.
Call Dr. Joyner.
Yes.
How do they get a hold of you?
You can go on the website at drjoyner.com, DoctorJoyner.com, or you could call us directly, 561-922-9396. The practice is the Joyner Hand, and again, my name is Dr. Michael Joyner.
Very good.
Right.
And in case you didn't get that, you can also call All County Healthcare. Telephone number there is 888-717-7170. Ask for Maddie, and she can get you in touch with Dr. Joyner as well.
Yes.
Excellent. Now, as one of the things that you had just said that I found was really interesting is that you're starting to replace the joints in the thumb area. What other state-of-the-art remedies are you seeing, or surgeries?
Right. One of the things that I like to focus on in the practice is, just as you said, new and innovative things.
Right.
And our goal is to avoid surgery when we can. But when we need surgery, we fix it. But if we're able to prevent that, I think that's the way to go. So some things that are new and innovative are such as regenerative medicine, we call it, like the stem cells. We hear a lot about it with the knees and other locations, but now we're starting to do it in the joints of the hand and wrist.
Really?
And so it's very exciting,
That
especially
is
with
very
arthritis
Yeah.
or a small tendon tear, and you want to avoid any, again, surgery or long-term casting. Sometimes regenerative medicine is a way to go.
Well, that is absolutely fabulous.
So it's exciting.
It is exciting.
And then
yeah.
even on to just anti-aging. We even focus on the focusing on the skin, and we talk about the vitamins one will use, as well as vitamins that will help for nerve, whether it's vitamin B6, the amounts, the dosage, also anti-aging for fillers. We talk about that if people are interested in it. So really we look at the hand as just a part of your entire wellness. So that's what we love about our practice.
I love that. I really do. And, you know, I think that is so, it's the new state of being a doctor and what they have to offer now. You know, it's just not... come in, let me see what you're doing. Oh, okay, no surgery, and then you're out, and then they don't do anything else.
Exactly.
I mean, I love the fact that that it's holistic.
Right. And I
Holistic
believe
in
in
its
that.
way.
I'm a big believer in
I
it.
am
And
as well. I'm totally
Yes.
anti-aging, honey. I'm totally anti-aging. Yes, absolutely.
Yes.
But that you know, incorporate, you know, diet, exercise,
Exactly.
vitamins,
Exactly.
you know, skincare, fillers as well. I
Right.
mean,
and people
all
don't
the
think about that with the hand, but that's so important.
Oh, it is,
so, right,
and you know,
exactly.
and I know a lot of people that have come in to have fillers in the hands.
Yes.
You know, to gain that youthfulness,
Exactly.
and also to do laser treatments on it to remove any of the sun damage
Right.
that might be on the hands, because you know, you're doing it for your face. Well, a lot of people are doing it. A lot
Right.
of women and men are
Right.
doing it for their face, but when you take a look at the hands, it tells everything.
You're absolutely right.
So
You're absolutely right.
That's fabulous.
Exactly. And then exercises in the morning, stretches, so important. Especially nowadays, we see a lot of people texting and using their phones. So you're getting more movements with single digits and normally.
Ah, yeah.
What I'm starting to see in the practice is that I see a little more tendonitis maybe than I've seen a few years ago. And then, well, it makes a difference in how I would treat someone as well. I might keep them in a splint, maybe longer, if I know they really have to text too often and we just did surgery. But those are things that now we're...
Can you just put a cast on their hand?
Exactly. If they're 12, we may have to.
Yeah, exactly.
Right.
Exactly.
So again, that goes back to the individual as well as the sign of our times.
Yes.
The sign of our times.
So I just like to take this moment to say thank you to All County Healthcare for bringing one of the top-notch professionals in hand surgery on our show. It is such a pleasure, Dr. Joyner, to have you here and you know, explaining the various issues that that our society is dealing with at this moment,
Right.
and addressing them and what to watch out for. You know, so that's-
Exactly. And in saying that, what we feed on in the practice as well as here in Boca Raton, we always say, as a Boca Raton hand surgeon, and there's so much more. So we talk about so many different aspects of hand and health and wellness and how it all plays a part.
Yes.
Even to the point where we even, I like to share that I designed even flatware that's ergonomic for your hands.
Really?
So it takes pressure off of your hands when you cut, when you use it. And especially for someone with arthritis, it can make a difference. And the primary reason is it avoids germs on the table. So coming from a surgical perspective, knowing being in the operating room, I mean, everything's sterile.
Right.
So
right.
I look at it to the extreme, but at the same time, bringing it into our daily lives. And if you go out to dinner, you'll realize we subtly put our flatware on napkins. We put it on the edge of the table. But with the touchless flatware that I invented, you just set it down and it avoids all the germs on the table.
That's so exciting. So tell
So-
me, did you bring a sample for
Oh,
us?
I carry it with me wherever I go.
Do you?
Right, I
Okay.
do. So I started.
Can you show it
right.
to us?
So I have, for example, this here is a touchless fork, and so when you set it on the table, I don't know if you can see,
Oh.
but it avoids all the germs on the table.
Well, here, we can do this. Okay?
Right.
Well, we'll set it up here.
Here we go. Yes.
Okay.
So here it is. So if you look, and here's this piece of paper. You could see if you had anything on the table.
Oh, that is
Right.
amazing.
So for example, if you're outdoors
Uh-huh.
in a patio and you just need to set the flatware down, you don't have to worry about the germs
That's
on the
ingenious.
table, which is incredible.
Yes.
And then as a hand surgeon, knowing the hand is nothing straight about the hand. So I designed the flatware to use in our hand. So it's curved. And even it has support.
Oh,
So
look
even if
at
you're
that.
cut and if you say pick up a tomato in a salad or a scoop of ice cream or anything like that, you have much more support. It takes pressure off of your joints. So when I say we do
Love
more,
that.
we're looking at every aspect of the hand and how it helps, things that can help in our everyday living.
Ah,
Yes.
so have you patented that now?
It's
Have you
patented.
got- yeah,
It's patented
okay.
because it has.
Where can we get that?
You could get it online. You still go to drjoyner.com and you'll see Touchless flatware, or you could go directly to Touchless flatware. It's on Amazon. You can order it on Amazon.
That is wonderful.
And now we're designing all types. So you got the plastic, children's wear coming out, steak knives. So it's very exciting.
It is very
It's a whole new
exciting.
line
It is. Well,
that makes a difference.
one of the questions I usually like to ask is, what makes you different than someone else? And I
Right.
think you have really hit the ball out of the ballpark here.
Well, I'm glad because
that is
I
amazing.
I feel with medicine now, you have to incorporate our entire way of living.
Yeah,
even though we're so subspecialized.
Right.
So, right.
Holistic.
Exactly.
Absolutely. I'm, a life and energy coach, and I kind of work in that same realm, holistic. Because
Exactly.
everything affects you.
Right.
It's just not your business or not just your spouse or it's the whole entire
Exactly.
realm that
Exactly.
affects you. So, boy, let me just see. Can you see that?
There we go.
Isn't that amazing? So when it sits down on the table, it's never touching.
Correct.
That is very cool.
Correct.
Very cool. So, and that's great for,
Perfect for gifts as well,
Yeah.
wedding gifts and
pretty soon. Okay, then we're going to have swirls on the back end of it.
right.
For wedding
Exactly.
gifts, I love it.
Exactly.
Oh, that is
Exactly.
wonderful. And it has just been such a great pleasure to have you here. That is so exciting. Now, do you have any of the other, do you have knives and spoons with you
Right.
as
So,
well?
for
or-
example, we have a 20-piece set. So
Oh, okay.
it has a salad, fork, regular dinner fork, knife, soup spoon, the whole 9 yards.
Oh,
And so that's
great.
for a table setting of 4. So it's a 20-piece set.
Uh-huh.
And then we have chopsticks coming out, touchless chopsticks. I have a patent on that as well.
Oh, my goodness.
A patent on the children's touchless flatware as well. So it's exciting.
That is
it's
very
definitely
exciting.
It's definitely exciting.
My goodness. I love it. I love it. That is great. That is great.
Yes.
So, what other things can you inform us about when it comes to the hands, using the hands?
Yeah, a couple things.
Yeah.
So we go on, there's such a large spectrum when we're dealing with the hand because we talk about definitely conservative treatment in anything we do, but then there's a role of surgery when necessary. So I still stay in touch with University of Louisville, Kleinert Institute. That's where I trained. And so we still have a pipeline here in Boca Raton for even a patient that needs hand transplant, even to that extreme.
Really?
Right.
Wow.
So they're still doing hand transplants at that institution, which I'm tied into. So that's exciting too. So when you're looking at all aspects for hand, you go from one extreme all the way to the other for conservative treatment versus hand transplantation. So it's
That is incredible.
very exciting.
Yes. And,
Yes.
and when you transplant the hand, does it still work as normal or
Right.
how does that
So
happen?
That's the whole thing. So you're really in the hand, you're looking at the bone, the tendon, the artery, the nerve, the veins. And so each is reattached. And so when I was there, we had a person that had a hand transplant. And so he was able to now follow up once a year to where he could pick up, for example, a glass, an item, and have a small pinch and use it to have a drink or have a dinner or pick up a utensil where he couldn't before.
Wow.
Right. So those are the things that can make a huge difference in someone's lives. So that is exciting. To hear even one procedure where if, for example, someone has extreme wrist pain. And I like to use the example of lifting milk, like a gallon of milk. And they have no problem lifting, but then to turn it
Yes.
to pour, sometimes there's a problem. A lot of that joint, that area, can be from arthritis. It could be from a small tendon tear. And there's a lot of research in that. And that's where we use regenerative medicine in that case many times.
Okay, so
And
the stem cell.
The stem cells.
Okay.
But on the extreme, I would replace that joint. It's almost with a ball and socket where someone can rotate their wrists. And a gentleman who just finished, it was incredible because he was a farmer and hard worker. And so he would still lift and he went right back at it. But what he said he can now do was his small dog that his wife had, he could not lift the dog up into the chair to watch TV with him. And then after the surgery, it was no problem.
Oh, that's
incredible. It was incredible.
Yes,
so something as simple as that, we forget.
I got to tell you, that's not
And
so
that
simple,
stood
though.
out.
I'm one of the biggest animal lovers, anyhow. And, my dog is everything. So I understand
Exactly.
that.
Yes. That made a difference in his life.
That's so great. That is so great.
So, yes.
What are some of the other things that you're seeing as well? Some of the other, people that you work with or things that you have to deal with the hands? You said carpal tunnel. You said the joints.
Right, exactly.
Okay.
Also with the nerve, sometimes it's a tingling sensation or weakness in the hand that could be from a different nerve. Sometimes it's from the elbow.
Oh.
So sometimes we'll do what I call cubital tunnel release. And it's similar to carpal tunnel, but it's carpal tunnel at the elbow. And a lot of times people just misdiagnose it.
Yeah, I've never heard of that
and
at all.
that's the thing, exactly. There's another one I see a lot of for new parents and new grandparents especially. They get a tendonitis in their wrist, and it's from picking up the little ones and the repetitive motion. So that's another example of something I see quite a bit, but sometimes it goes misdiagnosed. They think it's something else.
Yeah.
Or they say, oh, maybe I just strained it.
Yes.
And then they don't treat it, and it gets worse. And that's when I have to take care of it. But if you get to it early, in general, you don't need surgery. There is a surgery to fix it. But 9 out of 10 times, if you get there early enough, you could treat it. So I see a lot of that as well.
Wow.
Tendonitis,
I've not heard of that, carpal tunnel in the elbow.
Right, exactly.
And that's such a delicate place.
It's a delicate place.
Oh,
exactly.
my goodness. You
Exactly.
hit that the wrong way. And
Well, that's exactly what it is. It's just like your funny bone.
Yeah.
That's the nerve that's irritated, that's going through a canal that's too tight.
Ah.
And sometimes that canal has to be released, or certain therapy techniques, stretches can help improve that.
That's so wonderful.
Yes,
Well, thank
yes.
you again, Dr. Joyner. It's been an absolute
Well, I
pleasure to
appreciate
have
it.
you here this evening, helping to educate us. Also gave us some more insight as to some of the other symptoms that you might be dealing with. And if you have any questions whatsoever for Dr. Joyner, just please call All County Healthcare. Ask for Maddie. The telephone number is 888-717-7170. Listen, we'll be back next Tuesday, okay? Every Tuesday between 6 and 7. So make sure you turn us on, whether it's 1470 AM or 95.3 FM. Watch us on live stream, Facebook, on All County Healthcare, and also allcountyhealthcare.com. Come and see us. We'd love any questions that you might have. So thanks again. Have a great evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.